There are two basic but quite different ways of thinking about regulation. One approach is to create and apply rules intended to be applicable in nearly all situations. The simplest example of this approach might be speed limits. On a sunny day when there's little traffic, it might be safe to go faster than the speed limit. But during a winter storm, safety would require going much slower. In rules-based regulation, there's only one speed limit, and drivers are required to follow the rule. An alternative approach is a risk focus to regulation. Risk-based regulation focuses on potential harms and tries to be proactive in stopping them before they occur. The idea is you can't possibly regulate every aspect of a professional's performance, so you focus on preventing the riskiest activities in order to prevent the biggest harms. So, are health regulators rules-based or risk-based? Let's consider the example of unprofessional or misleading advertising. Say there's an advertising rule and a health professional breaches it. Someone complains, most likely a competitor who feels that the advertisement has given the other professional an unfair advantage. The college investigates the complaint, and the Inquiries, Complaints, and Reports Committee finds that the advertisement was in violation of the rule. In this particular example, the health professional who has been found to be in violation of the rule appeals the decision. At the first level of appeal, the college's decision is upheld. So, the professional appeals again. The court also upholds the decision, and the professional removes the advertising. By this point, the college has spent tens of thousands of dollars, if not more, pursuing one individual for breaching an advertising rule. There's no doubt that the rule exists and was broken. Having this rule and enforcing it is demonstrative of a rules-based approach to regulation. Because money and human resources are limited, pursuing the advertising breach meant other regulatory activities had to wait or be attacked with less vigor. The question that risk-based regulation poses is whether this is the most effective approach in order to meaningfully reduce risks to the public. So, how does a regulator take a risk-based perspective? The starting place is to collect and use data to try to be objective. What potential harms might occur without intervention? How bad are these harms? How likely are they to occur? What means are effective at preventing the worst harms? This slide shows some of the data sources that we use at the college. We collect and monitor this information to try to detect patterns. We use the information at all levels of the college in the hopes that it will make us better at our job of regulating in the public interest. Here are some specific examples. We have a practice advisory service at the college. Physiotherapists and members of the public can contact the college and seek advice by phone or email. Our practice advice team records the nature and frequency of the calls they receive. When they identify a trend, they report it to the senior management team. In order to determine whether the trend is a flag for an emerging risk, we triangulate the trend against other factors, such as a recently published standard, a change in insurance company rules, increased financial pressures, or a handful of people suddenly breaking the rules for some specific reason. We use this information to help us understand the problem that we're trying to solve and to determine the appropriate regulatory response. In the example illustrated on the slide, our advisors suddenly began to receive a high number of calls about supervising physiotherapy assistants. We knew that Council had recently approved a new Working with Physiotherapist Assistants standard, so it seemed that the problem was a lack of understanding of the expectations around working with a PTA. We thought it was probable that physiotherapists needed more educational support about the new rules, so we developed these and advertised them through our monthly newsletter. Then we watched to see whether they were being accessed on our website and to see if the number of calls to our advisors went down. We think that we reduce the risks associated with physiotherapists breaking the new rules by supporting their understanding of the rules through promotion, education, and the assistance of the practice advisors. In an article about the legal profession, scholars said that an important thing about risk-based regulation is that it moves a regulator from a general commitment to the public interest to identifying specific and relevant risks of harm on which the regulator will focus. This next example demonstrates our effort to do that. Our Inquiries, Complaints, and Reports Committee became concerned about the increase in the number of cases they were reviewing, which included irregular business practices and significant billing issues. They reported this trend to Council. This and other information from the environment led Council to identify this issue as the focus of one of our strategic goals. A first step in our regulatory response to the problem was to articulate a philosophy that would inform all college activity. Council passed and published a statement of zero tolerance for inappropriate business practices. The zero tolerance statement became a part of the committee's decision-making tool, and it also became a communications and education focus. The college published it to warn physiotherapists and to demonstrate our commitment to reduce this problem to the general public. As a result of these steps, we saw an increase in the number of referrals of these sorts of cases to discipline hearings. We're also receiving more reports and cooperation from insurers who are suspicious of fraudulent activity. It's too soon to see whether there are fewer incidents of inappropriate business practices, but we hope that the data will show that within the next few years. The specific examples I've referenced were the enforcement of the advertising rules, the education about the requirements for supervising assistants, and the rules about good business practices. These are instances where the regulator has made some assumptions about whether certain rules are required or whether breaking them has the potential to cause harm to members of the public. But another aspect of risk-based regulation is prioritizing the risks that we will focus on to ensure that they are the right things to worry about. Prioritizing one risk will always mean deprioritizing another, of course, and research tells us that for regulation to be effective, the regulator, the profession being regulated, and the public must agree on what the focus should be. Unfortunately, this can be much more difficult than it sounds. For example, in the mid-2000s, when hospital infection rates made newspaper headlines in England, this understandably caused great concern. The Department of Health set reduction targets, but they also needed to add hospital beds. The policy advice was that more lives would ultimately be saved by permitting a certain level of infection and spending some of the savings on getting more beds. This was an unacceptable trade-off for the politicians, however, so in the end, the money went to deep cleaning every hospital ward in the country. It's not really possible to say for sure that this was the wrong decision, but it's a good example of how well-intended groups can have different priorities, which brings me to why we need you today. Thank you for watching this video so far. I hope it has set the stage for our request. We need to know what you think the regulator should prioritize. I'm going to provide you with some examples to help you understand the request, but I'm a little worried about planting ideas in your head, so please consider your own encounters with healthcare professionals or the encounters of others that you know. What has gone wrong in these instances? What has frightened you? What has stressed you out? Some risks are very obvious, for example, a risk of misdiagnosis or sexual assault. Others may be less obvious. The risk that you will be treated rudely, which may have important consequences for you, or maybe the risk that you will not have all of the costs explained to you before you agree to treatment. We will ensure that you have time to talk it through with each other at the meeting, but we are hoping that we will come away from the meeting with a list of your priorities in terms of the focus that the college should take. We can do many things at once, of course, so the expectation is not for you to choose only one thing, but we need to know what is most concerning to patients and the public. I can't promise that we'll act immediately on all of your priorities because all of the stakeholders have to agree, but you can imagine how important your input will be in considering this important decision. If it would be helpful to consider the types of rules and requirements that we already have, I'd recommend that you click on the link in the slide. Maybe you could start by considering what the priority of those rules might be, whether some are unnecessary or not too important, or if there are any that you think we're missing. Thank you so much for your help. We look forward to seeing you at the meeting.